Well, the bill before Congress now is a bad idea. It's basically the ground floor architecture of what will ultimately become a single payer system. The bill today before the United States Senate is a bill that basically says the following. You have to provide more coverage that's being provided today, but you have to do it at a lower cost, and everyone in America must buy it. Well, these folks know that you can't provide more coverage at a lower cost in the private market, that ultimately the private market will decide they're not in the business of losing money. And then the next step will be, oh well, since the private market won't do it, we need a single payer system. And I know that this is the first step towards a grand plan to ultimately implement in America a single payer system. And above everything else, the one reason why I'm against the single payer system in America, beyond the fact that it takes away our choices, beyond the fact that it takes away competition, is the fact that in every country on earth where there's a single payer system, they have to ration care. And I do not want to live in a country where health care is rationed, where decisions are made about who gets what treatment based on their age and their conditions. I don't think the vast majority of Americans do either. But that's what's happening in Washington today. Now, really this debate is not about health care. It should be about health insurance. There are some issues in health care that need to be addressed. I think there's consensus on those issues. Electronic medical records, the sharing of best practices, understanding outcomes in different hospitals so patients can shop what's the best setting for their care. There's consensus for that. I also think we have to have a very serious conversation about lawsuit abuse reform. Lawsuit abuse reform in America, and lawsuit abuses in America when it comes to medicine doesn't just drive up the cost of health care. It drives up defensive medicine, which we all pay for. But really what the fundamental issue in America is the 20 or 30 million Americans that do not have health insurance. And the question is, how do we solve that? They believe, this meaning this congressional leadership and this president, that the ideal way to provide health care for 30 million Americans is to have the government do it. I believe that the best way to do it is through a vibrant private market where you can buy the health care coverage you need at a price you can afford, independent of your employer. In essence, I'm the father of 4, we're a family of 6, we need comprehensive health insurance. And I recognize that that's going to cost a little bit more than some other plans, but that's what we need. I would love to live in a country where I can buy comprehensive health insurance at a price that I can afford and that I could do so independent of my employer, that I could buy it the way I buy my auto insurance. On the other hand, my brother-in-law is 24 years old, student. He never gets sick and he thinks he's never going to die. Okay? He's not going to spend $400 a month on health care. What he needs is probably a smaller plan that covers primary care and catastrophic hospitalization. He'll probably have a higher copayment, he'll probably have a higher deductible, but he'll have low monthly premiums. That kind of flexibility, to have those enormous differences in packages that are offered in the private market, we don't have that in America today. That should be the goal of what we're working on in Washington, D.C. And I hope that we can push the reset button and start this debate again.